it's not a rigid structure. That is why when you're doing exercises, you're able to bend, you're able to flex, you're able to extend, you're able to do lateral flexion because it's the vertebral column is a flexible structure. Then between the various vertebrae, we have intervertebral discs, which form about 1/4. That is a quarter of the length of the column. So if you are to look at the length of from just below the skull all the way to the coccyx and measure that distance, then you measure the distance of each vertebral body and measure them all the way, and then measure the length or the width of each intervertebral disc. You will find that if you are to add all those intervertebral discs, you will form about a quarter, 1/4 of the length of the column. So if you are to say, for example, the length of the column is 20 centimeters, a quarter of 20, that will be 5 centimeters. That's just an example. So it forms around a quarter, 1/4 of the length of the column, just vertebral disc, if you are to add all of them, their width or their length. Yeah, that is just a picture of the back, looking at it from anterior, from the front. And you can see C1, that is called atlas, or some of them have special name, like C1, you consider as atlas, it's called atlas. C2, that is vertebra 2, is axis. Then you can see vertebra 7, C7. One of the thing about C7, it has a very long spinous process. Yeah. Then you can see the others. For example, L1, you know, vertebral, that is lumbar vertebra 1. That is where the spinal cord ends. Yeah, that is that the lower part or lower border of lumbosacral 1 is where the spinal cord ends. And then you can see lumbosacral 5. Yeah, so basically that is just the back, looking at it from the front. Yeah, then surface markings of the back, you should be able to have an idea where they are located. Like if you look at the iliac crest, that is in the ilium, usually it's at the level of around L4 vertebra. That is the one that mostly you will use if you are to find a place where you want to put a spinal needle through that the lumbar vertebra. When you're looking for cerebrospinal fluid, you want to be able to find the level of L4 so that you can be able to put a spinal needle. So you use the iliac crest. So you hold the iliac crest, then you make a line joining the two iliac crests. Then that will probably be at the level of L4. And as we said, the spinal cord ends at the lower border of L1. So if you put a needle through the space between L4 and maybe L5, then you are sure that you will not injure the spinal cord, because at that level they'll mostly be fibers. Yeah, and last time we talked about the cauda equina, basically just fibers, and then there is the spinal fluid there. So you can be able to get the fluid. So basically those are surface anatomy. You can be able to know the inferior angle of the scapula, where does it end at what level of the rib. As you can see there, you have to count is 1, 2, 3, 4, 5, 6, around the 7th or the 8th rib. That is the inferior angle of the scapula. That is where it ends in somebody who is standing upright in anatomical position. And so basically surface anatomy, you should be able to just from feeling the surface, you can be able to know where the various structures will be located. And of course, there are some that you can even feel. If you are to feel your back, you can feel the spine of the scapula, for example. If you are to touch your back, you can actually feel them there. That is basically surface anatomy. Yeah. Then the muscles of the back, we have superficial, and then we have the deep muscles. Usually, we will not go into a lot of details about really the muscles of the back, but at least it's good that you know that there are those muscles. And like trapezius muscle, all of them, as you can see, most of them will have attachment to the spinous process of the vertebra and also the transverse processes and so on. Yeah. And then, of course, you can see some of the muscles originating there extend to the upper limb, to the anterior abdominal wall, and so on. So it's good to have an idea and know that these muscles exist. Of course, in your own time, you can go into more details on the same. Then there is the deep muscles, and you can see those muscles. So basically, these deep muscles help, keep the upright position in when somebody is standing, is able to stabilize the spine, and be able to direct the weight, the body weight accordingly. So I'll not go into all the much details there. Yes, then the curvatures. As you can look, if you were to look at somebody standing upright in anatomical position from the side, from the lateral side, usually there are curvatures so that your spine or vertebral column is not straight all the way. It is not. In fact, if it is all straight, then there is probably a problem. There are some curvatures. And then you can see in a newborn, usually when the fetus inside the uterus, they are usually in almost a curved position, as in the head and the knees are almost touching. So there is that curvature. One curvature that is, if you are to look at it from anterior, from the front, it is anteriorly concave. Anterior concavity. It's one anteriorly is concave. If you look from posterior, it is more convex, and it is one curvature all the way from the neck all the way to the coccyx. So that is in a newborn, that is generally the curvature. And generally, when you look at a newborn, they have that posture. So when the child grows, as they start being able to control their head. When you do pediatrics, you'll be able to know the various milestones that we talk about. That at one point the child should be able to control their head. So at around 3 to 4 months, the baby should be able to hold up their heads steadily. And then at that point, the cervical curvature starts forming. And you can see, looking at it from the front, from anterior, it is more of anterior convex anteriorly. Anterior convexity is convex anteriorly. Because if you look at it from posteriorly, it is concave posteriorly. That is now the cervical curvature starting to form as soon as the baby start being able to control their heads. Once they are able to hold their head up steadily, then that curvature start forming. So this curvature that a newborn has, we call it primary curvature. So these others that form, like for example, the cervical curvature that start forming is considered as secondary curvature. So at 3 to 4 months, the cervical curvature start being visible because the child is starting to be able to control their heads. And then you can see for an adult, you can see the curvatures that are there. You see the cervical curvature, there is the thoracic curvature, there is the lumbar curvature, and then there is the sacral curvature. So 1, 2, 3, 4 curvatures. Remember the primary curvature is that of a newborn. That is anterior concavity all the way from the base of the skull all the way to the coccyx. But in this case, you can see the secondary curvatures in this case will be the cervical curvature and the lumbar curvature. The lumbar curvature looking for the cervical curvature looking for from anterior, it is convex anteriorly. When you look also at the lumbar curvature, looking at it from anterior, from the front, it is convex anteriorly. Of course, posterior will be concave. Likewise, so those are the two secondary curvatures that form, the cervical one and the lumbar one, lumbar curvature. So see the thoracic one maintain that primary curvature and also the sacral. It retains that anterior concavity. The two of them are maintained. So the one that form is the cervical and the lumbar. Of course, again, just a revision, you can see where the spinal cord ends at around the lower border of L1, that is lumbar vertebra 1. And then from there, of course, you just have the filum terminale, which we said is basically a continuation of the pia mater, that covers the brain also. It continues all the way to attach to the coccyx, That is the filum terminale. And then you can see from the spinal cord, the end of the spinal cord, conus medullaris, we call it, there is the subarachnoid space remains. And that is the one that is filled with cerebrospinal fluid. That is why when you do spinal tap or lumbar puncture, you are able to get the cerebral fluid, CSF, cerebrospinal fluid. And remember that place where now the subarachnoid space is filled mainly with those nerve fibers. Yeah, the terminal nerve fibers of the lower thoracic vertebra and lumbar vertebra. That is why from the conus medullaris, there is the cauda equina. And then, of course, so generally, the subarachnoid space, which is filled with cerebrospinal fluid, ends at around the level of S2 and S3 sacral vertebra. That is where the subarachnoid space ends, around S2, S3. But of course, the filum terminale continues all the way to the coccyx, as you can see. So that is the revision I think we had mentioned last time. Yeah, again, just showing the vertebral column curves. You can see the cervical. The secondary one will be the cervical curvature, which is convex anteriorly, and the lumbar curvature, which is also convex anteriorly. And then, of course, posteriorly, they will be concave. So those one usually are considered as lordosis. So you'll hear a lot about lumbar lordosis, lumbar dolosis. So that curvature of the lumbar and the cervical region are called lordosis. And then that curvature that is there in the thoracic region and the sacral region, we call it kyphosis, usually termed kyphosis. So in certain scenario, you may find, especially the lumbar lordosis may be exaggerated. So sometimes it's just called lordosis. So exaggerated lumbar curvature. And sometimes that exaggerated thoracic curvature is sometimes termed as kyphosis. Yeah, so vertebral column curves, secondary curvatures, which I had said is the cervical and lumbar, bring the center of gravity to a vertical line, which allows the body's weight to be balanced on the vertebral column in a way that expends the least amount of muscular energy to maintain an upright bipedal stance. Bipedal is basically standing upright using the feet or the legs, the lower limb. You see, for animals, they will use all fours. Yeah, but for us, we are